Have you ever been to the doctor to have your annual checkup and everything seems to be just fine? You happen to look up at the clock and realize that it's 20 minutes past your normal wait time. 5 minutes later, the doctor walks in, apologizes for your wait, looks you straight in the eye, and states that they need to redo your mammogram because it's a little spot they see. Well, you are not alone. Breast cancer is a disease in which malignant cells form in the tissue of the breast. I personally have had this experience with my mom. Then to find out that I have a long family history, including men that have been diagnosed with breast cancer that goes back several generations. But you can decrease your chance of getting breast cancer by being aware and doing these preventative steps: self-examinations, knowing your family history, and obtaining healthy habits. First, I will discuss where breast cancer starts. Then I will discuss breast cancer and its statistics. And finally, I will discuss some of the preventative steps to do to try to prevent diagnosis. Cells in any part of the body can become cancerous and spread to other areas of the body. Breast cancer starts when cells in the breast begin to grow out of control. According to the American Cancer Society, breast cancers can start from different parts of the breast. Most breast cancers begin in the ducts that carry milk to the nipple, and a small number of cancer starts in other tissues in the breast. Many types of breast cancers can cause a lump in the breast, but not all of them do. Most breast lumps are not cancerous, but they are benign. Benign breast tumors are abnormal growth that do not spread outside of the breast and are not life-threatening. Any breast lump or change needs to be checked by a healthcare provider to determine whether it is benign or cancer. The National Breast Cancer Foundation states that 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime. Breast cancer is the most common diagnosed cancer in women. It is also the second leading cause of cancer death among women. The National Breast Cancer Foundation states each year it is estimated that over 246,660 women in the United States will be diagnosed and more than 40,000 will die. Although breast cancer in men is rare, an estimated 2,600 men will be diagnosed and approximately 440 will die. Now that we know how breast cancer starts and some of its statistics, let's talk about preventative steps. You can decrease your chance of being diagnosed with breast cancer by being aware and doing these preventative steps. It is a good idea to get to know what's normal for your breast. Self-examinations. Begin by looking at your breast in the mirror with your shoulders straight and your arms on your hips. You should look at your breasts, make sure that they are the usual size, shape, and color. Make sure your breasts are evenly shaped without visible distortion or swelling. Raise your arms and look for the same changes. Feel your breasts while lying down, using your right hand to feel your left breast, and then use your left hand to feel your right breast. Use a firm, smooth touch with the first few finger pads of your hand, keeping your fingers flat and together. Cover the entire breast from top to bottom and side to side. You can begin at the nipple, moving in larger and larger circles. Feel your breast while you are standing or sitting. Feel all the tissue from the front to the back of your breast. Women find it easier to feel their breasts when their skin is wet. Now that you know how to do self-examination, let's get into knowing your family history. Women who have close blood relatives with breast cancer have a higher risk of the disease. Having a first-degree relative, meaning as your mother, your sister, or your daughter, with breast cancer almost doubles a woman's risk. Women with a father or brother who have had breast cancer also have a higher risk of breast cancer. Having two first-degree relatives increases her risk about threefold. The American Cancer Society states that less than 15% of women with breast cancer have a family member with this disease. About 5 to 10% of breast cancer cases are thought to be hereditary, meaning that the result directly from gene defects passed on from a parent. Genetic testing can be done to look for mutations in the BRCA1 and the BRCA2 genes. Families with the BRCA1 mutations, the lifetime risk of breast cancer is as high as 80%. Families that have the BRCA2 mutations, the lifetime risk of breast cancer is lower, around 45%. If you have inherited a mutated copy of either gene from a parent, you have a higher risk of breast cancer. Finally, we can discuss healthy habits and lifestyle changes. Lifestyle changes have been shown in studies to decrease breast cancer risk even in high-risk women. Limit your alcohol. The more alcohol you drink, the greater your risk. Don't smoke. Accumulating evidence suggests a link between smoking and breast cancer. Be physically active can help you maintain a healthy weight, which helps prevent breast cancer. Now, I first discussed where breast cancer starts. Secondly, I discussed what is breast cancer and its statistics. And finally, I discussed the healthy habits and lifestyle changes that you can do to prevent breast cancer. You can decrease your chance of getting breast cancer by being aware and doing the preventative steps that we discussed. Your self-examinations, knowing your family history, and having healthy habits. So in conclusion, remember that breast cancer can only affect women, but men as well. And that breast cancer prevention starts with healthy habits. There is over 2.8 million breast cancer survivors alive in the United States today. So let's be healthy and let's stay aware. Thank you.